I'm Maura Carley, founder and president of Healthcare Navigation, and today we're going to talk about one of the most important topics imaginable, in my opinion, and that is managing your healthcare coverage. And we'll start with some basics because there's a lot to cover. And I truly believe if more people became skilled in this area, we would actually reduce the costs of healthcare. My message to you is somewhat analogous to my message, leave nothing to chance, which I've mentioned many times about enrollment. And my message that's relevant to this video is stop with the trust. Stop with the trust. People are way too trusting that claims are processed correctly and that medical bills are correct. And many people pay dearly for that trust. So let's start with the basics. We started this video series pretty much with basics, and if you don't understand them, you need to go back and watch the videos and read our blogs that have the accompanying material, written material that goes with them, because you've got to understand your deductible, how much it is, how it's structured, what product you're in, what rules come with that product, whether you have out-of-network benefits, and so on. So you've got to start there. That is the starting point. The next thing, you have your new card or cards. You must create an online portal. You go to generally whatever your card might say, or anthem.com, myuhc.com, mysignet.com, you know. The major insurers all have websites that will contain your benefit information, your provider search tool, and your claims. And typically you want to do this for medical claims. Sometimes pharmacy is combined with medical. Other times you have to create a separate portal for that. And certainly if you have dental coverage, you should do that as well. And become familiar with that site. Because the point is, every time you have an interaction with our healthcare system, it should generate a claim. And you want to go online and look at how that claim was processed and do your best to become skilled at knowing, was that processed correctly or not? And I don't need to talk about clients. I can just talk about some of my own experiences that aren't that old. We started the series with an example of a bill I got that was thousands of dollars, and I didn't owe a penny of that. But that's because I knew it was medically necessary. I knew it was in network. I knew I had met my deductible. And I had been on my site seeing that the insurer was asking for additional information from the providers billing people, and they never submitted it. They just kept submitting the claim and having it rejected. So wasteful and so ridiculous. And then sent me the bill saying insurance has paid its portion, this is your responsibility. Well, it was nonsense. And no one even had the courtesy to get back to me when I left a voicemail message saying, now we all know I don't owe any of this. So I think you better give my insurer what they're requesting. And then it was paid in full. Similarly, you want to understand what your co-payments are and your co-insurance. Recently, I had a couple of months where I was seeing a chiropractor after an injury, and they were asking me for a co-payment associated with a specialty physician. And when I went online to look at how chiropractic claims should be processed and what my responsibility was, it was different. It was 10% coinsurance, which, it was a couple $100s that I paid, which they did refund me, but a couple $100 is a couple $100. And in a previous video, I may have already mentioned my husband's dentist. I guess he's a great dentist, but they don't follow the rules. And I think most people just pay them. And we have a thing going where I just call and say, excuse me, the explanation of benefits says X, but you charge my husband X, which is X plus X. And they just process a refund. But sometimes it's just such a hassle to deal with a refund. And so the point of this is to stay on top of it and improve your skills so that you become pretty good at identifying mistakes and being able to read an explanation of benefit statement. That is the document that the insurer creates when they process a claim. Many of them are absolutely inscrutable, and they should be simpler. But you can improve your skills if you stick with it, because, after all, if you don't understand a term, you can search and get the meaning of that term. Many of these sites now have a chat feature, and some are better than others. But if you have a question, start with chat, because we all know calling is a potential headache. So today's message is just, you've got to invest some of the time in this to make sure you're not overpaying. And we'll get into a greater level of depth another day. That's it for now. Do your homework, and so that you have more of a handle on the basics of your plan, and stop with so much trust. Sometimes it is misplaced. Thank you for listening. Take care. I hope to see you again soon. Bye-bye.